It has been a fantastic day. Thank you all for all you've done. I sent my wife to gather all the ones who are out in about
In the ditch.
in the ditch. Not all the ones in the ditch. Anyway, welcome. It is the end of a Friday, and we've already had a few that had other responsibilities, and we may yet. But this is the part of the day that I actually am most excited about, and that's just a panel discussion. So you and we can see some of what's been experienced by the Faith in Rural Health initiative in counties. That's both what we've been a part of helping create, but also what we've come across that has already been happening. And the whole point of this day and the whole point of this panel is to really create an appetite in you to grab your corner of the sheet, is to ask the question, how can I, going back into my context, start this conversation in a way that maybe it's not been had, from the people who are in the ditch to when we're the people that are in the ditch, when we have the needs as well. So there's been a lot of conversation, and I hope it continues. But having said that, we've put together a panel of just a smattering of folks. Actually, when we first put this together, I had people from 3 different counties, and because of the hurricane, we cut that down to 1, except for Williamson here on the end, who was one of the people from Coffee County who said, "No, Paul, I'm coming." And so that's why it looks weird. He was originally part of the thing, but he is able to be here. The other folks from Coffee County and from Vidalia, those Toombs and Lyons counties, Toombs and Montgomery counties were all really affected by the storms and unable to be here. But, so that's why it's sort of lopsided, but so this is what we're going to do. I'm just going to tell you who's here, and then I'm going to let them all sort of go and take 2 to 5 minutes and share how they've experienced the Faith in Rural Health Collaborative. And then we're going to have some question and answer time, if that's okay. But Cecil Kilgore is not able to be here today. In his place is Miss Charlene Swain. And I can't say enough good about Miss Charlene Swain. She is the director of the Mercer Medicine Clinic in Putnam County, and she has been just a godsend for this initiative, but also for that county. She's a member of the New Life Christian Outreach site. I always screw that up, but yes. That is Reverend Kilgore's church, but also she has been a wonderful partner of this, and she's one of those people who always says, yes, we can make that happen, which is wonderful. So that instead of Cecil Kilgore, we have Miss Charlene Swain. We have Pam Douglas, who's the chief nursing officer of Putnam General Hospital. And she has been an amazing partner with this program since its inception too. She was I think at the first dinner we ever had in Putnam County, and very, very helpful. And then Craig Williamson is the pastor of First Baptist Church of Eatonton in Putnam County. And Craig is the first person I met when I started this position. Even before I was on the job, he sat by me at a lunch, and I told him what I was going to be doing, and he says, I got some issues with that. And so he has been both my best cheerleader, but also the one who has been quick to throw a wrench into any assumptions I have had, which is an important person. You need that person. So I hope that when they speak, they will talk a little bit about what it's like to form a collaborative, what it's like to first have those meetings and then start to piece together something in the community. But what's really interesting is Putnam County already had the seeds of this going. And we stepped into right at the right time. And so I hope you'll hear some of that story. Then we have 3 people, Reverend Pete Mattix. Pete, there you are, is the pastor of Lake County Country Community Baptist Church in Eatonton, and he's out by the lake, but he and Katherine Ware and Dylan Bowden were all part, and actually Craig was too, so he may jump into that too, all part of our first cohort of clinical pastoral orientation training. So this is the chaplaincy training that we're helping ministers learn some clinical skills as a minister in their local hospitals. And COVID really did kickstart chaplaincy at Putnam General Hospital, but leaning into this program, into Faith and Rural Health, has really helped sort of escalate how chaplains are used, and it's been a really neat journey. So I hope they'll share a little bit about that and what that's been like for them. And then I can't say enough about Willi Williamson, just because I met him and we had a 2-hour interview. He was one of the folks I got to do the qualitative interview with, and we had such a great time speaking together. His was a quote, if you'll remember, that he says it's a win-win situation, but every meeting we've had in Coffee County, Pastor Williamson has had the thing that sort of crystallized the whole meeting and had people thinking a little bit further down the road. So it's kind of funny that he and Craig are sitting next to each other. They're brothers of the same heart. So having said that, you each have a microphone. Please pass it down in whatever order you'd like to go. Just take a few minutes, introduce yourself briefly, and tell sort of how you've experienced the collaboration, and then we will have question and answer time, if that's okay.
I guess I have the mic first. My name is Charlene Swain. I am a registered nurse. I do attend New Life Outreach Christian Center, and my pastor is here today, Pastor James Kilgore and First Lady Kilgore. I am the manager, the office manager of Mercer Medicine in Putnam County. Been there 3 years, and we just continue to take care of the community. I'm standing in for Elder Cecil Kilgore, but like I said, I cannot be Elder Cecil Kilgore because he has a lot to say. But the collaboration started at Putnam General. I think I attended the second meeting trying to get the community together and take care of people in our community. And when we came together, we found out some things that we weren't doing or things that we needed to do to be more in the community and help people. So we started asking questions. We started out with the sticky notes and we put them on the board, and we found out from that night that there are things in our community that we need to do, and that's how the collaboration started. I don't want to jump too far ahead, but we have a great day coming on November the 2nd. That is a collaboration in the community. It is a health fair. It is a steeplechase race that starts at 7:30. Then leading from the steeplechase race, we are going into the health fair. And we've got lots of vendors coming, reaching out to the community. It will be at the plaza in Eatonton, downtown Eatonton. It is in walking distance of our community. So hopefully people will come and get the help that they need, get information that they need, get some testing done as well. So we will be there, and at the end of the day, we will have a gospel community choir that is going to sing a couple of songs, and that's where Elder Cecil is going to take place, and we'll be singing in the community. So if you are near Putnam County, Eatonton, Georgia, we definitely want you to come and just kind of see what we're doing to reach our community. And that's kind of all I got to say.
Charlene said she couldn't speak. Anyway, so I'm Pam Douglas. I'm the Chief Nursing Officer at Putnam General Hospital. I've been a nurse for over 40 years. I'm a Christian. My grandfather was a pastor. My mother is a retired nurse. So I did clinicals at Grady shortly, probably after Dr. Scoggins had been there. So fell in love with critical care. I'm going to just tell you a little bit about how religion, faith, and medicine kind of have been intertwined in my life for a while. So I worked at an ICU in Athens, Georgia. And I was a young nurse, and young nurses always work nights or evenings. We didn't see the daytime. And I was there on the evening shift, and we had a new pulmonologist, Dr. Stephen Lucas. And I love pulmonology till this day because of him. So taking care of a patient is about 9, 10 o'clock at night, and Dr. Lucas comes into my patient's room and brings a chair up, and he was just sitting there, and I'm like, what do I need to do? Haven't I done? Tell me. And he was sitting there because the patient, she was a lady, was not doing well, and we knew that she was going to end up passing. She was at an end-of-life situation, and it was the first time I've seen a physician actually sit down and take some time, and he sat there quietly with her, no family, just really. So that was kind of the first, I'm like, okay, this will work. So let me get my notes. Charlotte did all this. All right, so now I want to talk. So when COVID hit, I was on the coast in Alabama at a conference with 4 other nurses, and I was sitting in a booth at a restaurant that Elvis Presley had sat in. I'll never forget this. And we were talking, and it hit Albany, and I'm like, oh gosh, that's South Georgia. It's not going to get, it's not going to get to us. So we really, we were ready. We had all of our little things together. That was the 10th, and then Thursday, it's the 11th, Thursday the 12th came home, and Friday the 13th was our very first COVID patient. And it hit so fast, and some of the things that we experienced were really hard on the physicians and the nurses. Our traditional treatments weren't taking care of anything, and we are problem solvers. Most nurses like to solve problems. We like to make sure we've done everything correctly, and we didn't know what to do. So it was pretty, it was extremely difficult. We never had that many ventilators. We never had that many BiPAPs. We never had high flow oxygen. So there's a lot of things going on that we were trying to learn. However, we couldn't save everybody. And so as many of the healthcare providers experience, we are a small hospital, and we experience approximately 11, 12 deaths a year. We didn't have a lot of people die, and the ones that did pass away in the hospital, that had been in the hospital, were generally elderly, and it was expected, or then we had some ER deaths. But we had more deaths in 1 month than we had seen in a full year. And so the doctor, I'll never forget, he's like, I don't know if I can keep doing this. It was so hard to sit down with the families, and so we were struggling. And at that point, nobody was coming into the hospital. And a lot of us weren't going to church, as we would be in the hospital on Sundays. Not that church services were going on, but it was like, okay, we're going to have to do something. So I said, can we get some pastors to come in, and we'll just keep them in the front of the hospital and try to get some type of a group going, not for the patients, but for the staff, for the nurses and other hospital staff and physicians. And I remember that group. It was a pretty big group that came and sat in our conference room, and we had a few nurses come up and talk about their experiences. And thank goodness they came together, and they said, okay, we'll come every Tuesday and Thursday. This is what time we're going to be here around lunchtime. And that's still happening right now. So that's kind of how our whole program got started. It happened to be one Thursday, and the preachers had not gone into the patient rooms yet. It was just, they would sit in the cafeteria, and I'm like, I don't know how this is gonna work. But they hung out in the cafeteria, and I remember going by, and they'd be sitting in there, and there'd be an employee, whether it was a nurse or an employee that had a family member that had COVID. There was just a lot of different times, and that's just by coming out and eating lunch with us and hanging around after the lunch hour. But there's a particular day that we had a gentleman in the emergency room. He was on the ventilator, he had COVID. He was not doing well. His two daughters had decided that they did not want to continue with the ventilator. So the two daughters were sitting in the emergency room with him, and they got a call that the ambulance was bringing their mother into the ER with COVID as well. And she was not doing well. And so she was wheeled into the same room with her husband. So we had the whole family. We had the mother and the father. We had the two daughters sitting next to them. Well, Tim Oliver was he was the pastor on duty that day. And he went back to the emergency room to speak to the ER staff and see if they needed anything. He kind of got wind of what was going on. And he said, "Babe, do you want me to go in there?" I'm like, "Well, of course," because that was it was a lot to deal with. And I'm like, I said, "But they both have COVID. They are both, it's a situation where one of them was intubated and we're on the ventilator." And so it was a high risk room. And he said, "I'll do it." So we put PPE on him, and he went in there and he sat with that family with the daughters until their parents passed away. But I think that was the first start of the impact that the pastors could make. And of course, the nursing and physicians were mentally and physically, emotionally exhausted, so they were always there for us. So it was every Tuesday and Thursday they came, and I thought, COVID got over, and they're still coming till this day. But one of the things that the collaboration and the formalization of the program, we had another challenging patient that didn't have a home. She needed some disability things. We found a home for her in Athens. Happened to be on a day that a pastor was out visiting her, and a few weeks prior to this, he made connections, and he came out on his own and visited a few days. Well, that pastor and his church went and packed the woman's house up to move, and they came when she was discharged and drove her to Athens and moved her then into her new apartment that was handicap accessible. And they took it one step further. They contacted a church in Athens, who then adopted the patient, the woman, and took over from where they had left off. So it was really kind of fun to have that sequence of events happen and that handoff. And it was just really, I knew we were doing something right. And then about that time, we get a letter or an email, or Craig or Mr. Horton, my CEO, was like, "There's a program called Faith in Rural Health. What do you think? You want to have it, first meeting at the hospital?" I said, "Well, what time's it going to be?" And they said 6 o'clock. And I'm like, "Oh my goodness." And so we ended up having the first meeting at the hospital. It was a great turnout. And from there, it just kept growing. And it's a very diverse group. It's a fun group. And I think that what's happening now, we've been able to keep a little momentum going for this second health fair. But my goal is to not just have a health fair that we can identify and screen for different diseases, but and it's not just for spiritual, when we need it, spiritual intervention, but talking a lot about what a spiritual intervention is. To me, it's more important to have the support group. There is data that those individuals that have support, the more support a patient has, the better they do. And I think that's what I would hope for, that we can accomplish. I just got to tell you one thing on your pastors. And I know you guys are really stoic, and I know that we kind of do that to you. I used to teach Sunday school for middle school, and I'm sorry I'm going over, but you got to hear this. And so we were talking about emotions and how to deal with it, and I asked them, I said, what do you think, Pastor Bill gets upset? Do you think he gets angry? Not one of them thought that he ever got angry, that he was ever upset, that I said, well, you think he ever gets sad? Maybe, but they just don't, they look at you all like the way some people look at physicians. But for some reason, physicians have a way of, I'm sorry, Dr. Ringer, but y'all can be very aggravating. They can get ugly sometimes. But I've never seen no, I've never heard you do that. I've never seen a preacher, though, show any of those emotions. So we grow up learning that you guys are just, you're just good. Sorry, it was longer than 3 minutes.
Well, I want to start by saying thank you to the Rural Health Innovation Center for the Baptist beer mugs that you left on the table. It's very kind of you. You understand our needs, and we appreciate that. I've been a pastor for over 40 years. I don't want to say how many because they'll begin to think I'm too old to be their pastor. But it's been a good experience. I came to Eatonton on April 1 of 2020 and moved into those needs. I closed the church I left, and the church I came to was closed before I got there. But it was good to move into those needs, and what's been talked about, the hospital got in touch, and fortunately by that time, and that was some of Mattix's leadership, had begun to get pastors together just for conversation and coffee, and out of that, we were able to respond to the hospital's request and to the hospital staff's needs. Just to be aware that there were people who would pray for them. And that seemed to be very powerful to them. I do want to say special thanks to the Rural Innovation Center and the project that's going on, and Paul Byrd, because I don't know how much further we would have gone with that had it not been for Paul coming in and the support that Paul was given to come in and lead us as a community to begin to develop into some further things. And therefore, I don't know how much we would still be thinking. I'm glad we are still thinking. It's great to hear Pam say, part of her goal is the camaraderie. Because that's a piece that I still think we have yet to complete, is to get the medical ministry people in the room just over the table for no purpose. We're not going to have a program. We're not going to set up a big project. Everybody's going to have to do something. We're just going to have dinner together, or lunch together, or just coffee, or use the beer mug, depending on your perspective. But I do think it's moving in that direction. I'm very appreciative of that. I appreciate as a new minister in that community, I've been there 4.5 years now, it's been that long, that those relationships in some sense had existed for years. I know I heard my predecessor the other day say, when he was preaching for Pastor Gus Kilgore years ago. And so I was reminded that those relationships in small community and rural communities, that's one of the strengths, hopefully. There's a lot of weaknesses that go along with that too. There's a lot of poor relationships that go along because we know one another's behaviors. But some good things have been going on too, and I think they'll continue. It's new for me to be a part of a health fair as a pastor. This is my second time around, and it's a great experience. The congregation is aware, and our congregation is very generous in putting money and me being able to say at a meeting of us, I can raise my hand and say, we'll cover that expense, and to have that kind of support. So very much appreciate it. But I do want to say, again, Paul's presence and his role that comes from McAfee and Mercer and the Rural Health Innovation Center is all a piece of it, a strong piece of it too. So, thank you.
Good afternoon, everybody. My name is Willi Williams. I'm listed on there as W-I-L-L-I, but my mama gave me an E, so Williams. And it says Williamson. I am this Williams, but I am Willi B. Williams Sr. son, okay? Make all corrections that's needed. That's okay. I was asked by Brother Paul about the letters that go behind my name because everybody wants their academia listed correctly, and I told him just put J.R. behind my name and put a period, and then he'd have all of mine covered. So we're here out of Douglas, Georgia, Coffee County, an area that has recently was hit hard by Helene. As a matter of fact, last Thursday night, I rode the storm out in my hallway with my family, and God was good to us. There are a lot of people in my community that are hurting right now. There's a lot going on, happening there, but I tell you, God was good to us. There was not one loss of life in that county. All of the trees that are down, God spared lives. And you know, you can get another house, you can get another car, but you can't get another life. So I'm just grateful for life. We were here preaching on Wednesday night. I was preaching down in Byrd here somewhere, and we're headed that down this weekend. And it's just a lot going on at this time, and we're glad to be a part of what God's doing in this season. And as somebody already spoke towards Paul, he was looking maybe for us to get somebody in the local area to do the work, but how many know sometimes God has to send in a Nehemiah to come in and be more effective than maybe what we can be. Our deal there in Coffee County is, my county is operating at its best today. My community operates its best during times of calamity, during times of storm, during times of crisis. But when there's no storm, when there's no crisis, when there's no hurricane, as my children say, we suck. It's not a good thing. It's actually not a good thing. And I often ask the question, what will it take for us to have to come together? And it always takes something. But even with this, I'm learning over years of bringing community together. Everybody's not going to come. Everybody's not going to be a part. But the Lord encouraged me. He says, find your 2 or 3. And all it takes is one spark to start a wildfire. And a lot of times we want lottie-dottie and everybody to come and be a part. That may not happen. And what I'm learning is, in ministry, we sell vision. But what's more important than selling vision is selling a burden. If the people don't have the burden, they're not going to be a part of it. They can see the vision, but if they're burdened, if there's a burden in their heart, and there's a burden in my heart for the rural community. I was born and raised there, lived in Atlanta for 30 years, so I've seen both sides of the fence. But there are great needs in our area. There's a lot that goes on there, probably like your community. Meth, the drugs is a big problem, and all of these different things. And as soon as you look like, as soon as you get one fire put out, 10 more started. But yet still we have to be diligent with it. And I think it's going to work better with it being a collaboration versus it just being my group and your group, when my group and your group can come together and it'll be our group. So the collaboration, and this word surfaced in one of our meetings was the word pool. the word pool. And sometimes we have pools that have no water in them. So what we're doing now in Coffee County is we're trying to gather resources. Gather resources, okay? To make a cake, it takes more than flour. But all I have is flour. But my dude here, he got eggs. Okay, now we need some of your milk from your mama house. We need some vanilla extract and some eggs. And we put it all together, and then we come up with a cake. So this is what we're purposing to do in my community, is to not just be a cake during the storm, but on days when ain't nothing happening. And I want to digress. Just last week before last, in my community, probably like your community, we were Republicans, we were Democrats, we was Trump, we was, whoever you call it names, you know what I'm talking about. We were all of those different people. And then in the matter of one storm, here we are singing Kumbaya. We were on the same playing field. But doggone it, we should have been on the same playing field last week. Because at the end of the day, we are all human beings. You cut me, I'm going to bleed. You slap me, I might slap you back. I ain't got that turn another cheek down. Y'all pray for me. So, but it's the collaboration, it's a win-win. It's a win-win. We're never going to lose coming together. In the Bible days, and I'm closing. He knows what that is. Let me close. In the Bible days, Israel came together for worship and for war. Worship and for war. And in rural Georgia, we have a war that we're fighting. There are people who are underprivileged. You have the haves and the have-nots. You have those who want to be healed, those who want to be whole, and then you have those who want to be delivered, and then you have those who want attention. And in the midst of all that, we have to weed out, and we have to work with them where they are. And unfortunately, there are a lot of people that are in the ditch. And when we are professionals are afraid of the ditch. Let that soak in for a moment. We're more impressed with being important in our status and this, that, one thing, and the other. But at the end of the day, all lives matter. All humanity matters. And we have to take time to care for one another. Because at the end of the day, before it's over, you don't know who you're going to need. You don't know who might have to change your adult diaper. So I'm just praying that not just rural Georgia, not just the state of Georgia, but the world, that we come together. Because we're all fighting the same enemy. We're on the same team. And unfortunately, we are just America. We are not the United States of America. That's the first word, united. And we are not that. Thank you.
We'll adjourn.
We got to get the offering.
Yeah, you might want to just go over what you understand the chaplaincy thing to be and how it works.
Yeah, well, my name is Bowden. I serve at First Baptist Church of Eatonton as the associate pastor and director of random things. And I was in the first CPO cohort, and I really didn't know what I was getting into, and I did it for two reasons. One is the old guy with the gray hair down here told me I had to. Craig, no, he has no hair. Yours is gray. Craig said, "You're going to do this." I said, "Well, sounds great." Two, one experience that I've had, which you all can probably relate to, was
one of the reasons that I decided to stick with it, because once it first started, I thought, I don't know about this. As a young minister, which I am still a young minister, as the youngest one up here on the panel, I went to visit a church member who was going through a very tragic loss of her husband and her grandson at the exact same time. One from natural death and one from suicide. And I made the mistake, as a young pastor, having not met this woman before, only been at the church a few months, asking her if I could pray for her. And she said, I'm going to quote her, "Hell no," standing there in her living room, and then told me I could leave. That was an eye-opening thing for me that, oh snap, I don't know what I'm doing. Because I, as a pastor, was equipped to pray for people and to be in that role, but as far as chaplaincy work, it goes way beyond that. So how do you respond to those situations where you run into immediately when you walk in the room hatred or anger or bitterness? I was not prepared for that as a 26-year-old. I had no idea what to do. And so the CPO program, coming from some CPE stuff, really dives into that in a group setting of, well, how could you respond? What could you have done differently to possibly have avoided that situation altogether? So that was one of the things that really I wanted some help with because I had no idea. So I left, and then I was reminded by a very good mentor friend of mine, you don't have to pray with them to pray for them. And when I was asking that question, it's because I just didn't know what else to do. I mean, I know how to pray for you. I don't know how to minister to you in any other way in that setting. And so that was the first thing that CPO is really great for, is diving into these what ifs and what could you do differently and all of this reflective stuff through verbatims and sharing stories and testimonies. And the second one, second question that I had, as a professing Christian and ordained minister, how do I minister in any setting, especially a clinical setting, to someone who believes differently than me? If I walk into the room of a Buddhist or a Muslim, I don't know enough about that, if I'm being honest, to engage with them in any way in those conversations. And so again, what do? We know what we're used to doing, and we know how we handle things, and it's a lot easier when you know you're visiting one of your church members. I know old Ethel and how she acts and how she responds. That's not a real person, I won't use a real name. But I know that she's a cantankerous old woman and what I can and cannot get away with. Walking into a hospital room of somebody you have never met, all you know is the name on the door, I was never prepared for that, and I still don't fully feel prepared for that. But through CPO and a glimpse into CPE, which I will have time for 1 year, I do feel more experienced in those things through the group setting, of group conversations and sharing, and just those experiences coming together. So CPO is a great thing for pastors and ministers who may or may not have seminary or secondary education, or who have just never had any experience at all in the clinical setting. We all have experience in house visits and shut-in ministry, but the hospital is a totally different animal. And CPO is a great introduction into that world. I'll pass it to Pete.
Wow, man, that was good. As we say, let's pray and go home now, right? I need to apologize to Paul before I begin. I went into this thing really with a lot of apathy. I just said, I don't really need it. And quite honestly, here's the reason, guys. I was 34 years in a pharmaceutical career that was in the hospital. I sold HIV drugs, hepatitis drugs. I was in Grady, I had Grady, I lived in the hospital. If I wasn't in the hospital, I wasn't making money. The last 7 years of those 34, I was bivocational as a pastor. And God began equipping me and preparing me for the ministry that laid ahead. So we go down to Putnam County, and what Pam didn't tell you when she met with us pastors, we had a really good, strong group there that started back in 2019, and it was born out of the desire that came from the pastors to just have friends, just have some folks that we could gather in an inner circle and kind of share, our concerns and our thoughts and, just as pastors get together. So the hospital reached out to us at the beginning of the pandemic and wanted us to come meet with them. And what they promised us at that meeting was a free lunch every Tuesday and Thursday. And so we kept hearing about these fried pork chops. We have a hospital that's got a great cafeteria. In fact, people from the community go eat lunch there during the day. Even on Sunday after the church, you may get an invite to go eat at our hospital. That's how good the food is. But I tell you, brother, I went into this thing thinking, okay, you know what, let's just check the box. And what I realized as I got in there, even as a pastor who has now 14 years of pastoral experience, as senior pastor, that, and even with my hospital background, that it was extremely beneficial for me to sit and listen and just absorb. And I tell you, I've had a lot of experiences with young pastors. I have a heart for mentoring. In fact, I've got an intern program at our church right now. I've got one right now that came to me 2 months ago from Liberty University, and I'm amazed at people who want to be a pastor, but yet are afraid of some of the things that come with it. Here's an example. The guy I had before this guy took him into the ICU with me one day. I had an older lady in there who was actually in a coma. She was on a ventilator. And we went in there, and she was extremely sick. You could smell the sickness in the room. She was that sick. And the family wanted me to come in and pray over her. So I asked him, I said, okay, I said, and I'm going to use the name Derek. I said, Derek, I want you to put a hand on her shoulder and a hand on her leg. And I put a hand on her shoulder and a hand on the other leg. He was on the other side of the bed, and I looked at him, and he wasn't doing it. I said, put a hand on her. I said, we're going to lay hands on this lady. We're going to pray over her. He said, Pastor, I can't do it. And I said, why? I said, what do you mean you can't do it? I said, you're trained to be a pastor. He says, I'm afraid of germs. And I said, oh my goodness. And I mean, that was a real conversation. But the reason why I share that, and that is funny, because you don't envision a pastor being able to, you're going to be snot cried on every day as a pastor some days. But he was afraid of that. And quite honestly, what I've learned is not all pastors are comfortable in that space. There are a lot of us that, we're really good standing there preaching on Sunday and speaking as orators. But when it comes to going to the bedside of somebody that's extremely sick, some just don't even know what to say. And just like I think it was you, brother, that said, and I learned this in that program, sometimes you just don't say anything. Sometimes you just listen and you let them direct you. Now, we've got such a good program now at the little hospital we have. I love it. In fact, I'm surprised other places are not doing this because there's so many benefits with it. I mean, we love doing it as pastors because we're called to ministry. We love to minister. And in the process of these past couple of years, as we put this program together, we've kind of massaged the kinks out of it. Those that were comfortable stayed in it. Those that were uncomfortable rolled out of it. I mean, it's just, process of elimination. If you don't feel comfortable, you're not going to keep going. So we've got it now down to a group of pastors that are volunteers that come in on Tuesdays and Thursdays. My admin assistant puts the schedule together. Each of us typically have one assignment each month. We come in at 12 o'clock. We're there from 12 to 2, sometimes later. We eat in the cafeteria. We're there for the staff. We go to the chapel afterwards. We sit in the chapel for a few moments. The staff knows that if there is a need or they want to pray, they want prayer, that the chaplain, the volunteer chaplain, will be there that day during the hours of 12 and 2. And then typically what we'll do after that, this is where the program is really expanded. This is where I think the training with the CPO has really been beneficial. We'll go down and meet with the case managers, and the case managers know why we're there, and they will typically have 1, 2, or 3 patients at the small hospital that will be in need of prayer. And like actually this past Tuesday I was there. It was my day to be there. And so I did everything. I was in the cafeteria, met with some staff. I've got in my phone, we've created relationships with the staff, and that was probably one of the great benefits of this. But I was able to go down and pray with a gentleman who was in his early 90s who has been in the hospital now for well over a month. And his sweet wife, he was kind of comatose, but his wife was there. And so she and I prayed together, and she was very appreciative of it. But the CPO program has been absolutely a wonderful thing for all of us. In fact, what we're trying to do now is get all of our pastors who are there as volunteer chaplains to go through this. And hopefully we can do that. Pastors are very busy. Sometimes it's hard to get them to break loose. But, the good thing about this program is it's been designed in such a way it's virtual. So you can do it from anywhere where you can turn your phone on or your computer. And it's been a great program. So thank you, brother. And I apologize for always telling you, brother, I just don't have time. So thank you for staying with me.
I'm the last one, so I'll be brief. I can say this, if you ever played baseball, I'll tell you my name in a second. If you ever played softball, I'll say, and then sometimes you clean up batter. The cleanup hitter, I'm one of those. But my name is Katherine Ware, and I'm Associate Minister at Ebenezer Baptist Church in Eatonton, Georgia. And I was asked by Mr. Horton, CEO at Putnam General Hospital, if I would consider being a chaplain at the hospital. And he gave me his number, right over here, Pete's number. I called him, and then I think we met in the cafeteria for a brief meeting. And I decided I wanted to go further. And so I sent in my application to be a chaplain. But when the first meeting we had on the Zoom, I have to be honest, Paul, I didn't think I was gonna make it because I didn't see any other females. I was the only female. And I wasn't intimidated, I just wanted to really work. But I enjoyed the group of fellows that I was learning with. And they encouraged me, and I learned a lot of gave good examples, and it really helped me. I grew a lot into my ministry and also learned a lot about chaplaincy. I'm from a different generation, and so I'm 75 years old, and I never saw any chaplains when family members in the hospital. And then in 1994, I never saw any chaplains that came to visit my daughter when she was in a coma for 4 months. I had no experience with chaplaincy. And so, but after taking this class, it helped me in my ministry to understand more about suffering, more about giving compassion, and learn about listening. And there's a time to be silent, and there's a time to speak. There's a time not to pray, and there's a time to pray. So at this age, I'm gonna hang tough with these fellas. They have more energy than I do at Putnam General Hospital. I enjoy being a chaplain. I enjoy serving the Lord. I enjoy doing everything that He sends me out among people to do. And that's my remarks.
Hold on to it. I thought this would be 30 minutes, and I'm glad it took exactly as long as it did because I wanted to hear every word. But this is time that, please, if there's any questions you may have for these folks about collaborations in their counties or about the chaplaincy training, we've got about 10 minutes.
How long is that chaplaincy training? How long is the chaplaincy training, and do you do it on Zoom?
Designed to be 12 weeks, I believe, 12 sessions, and depending on, you do it every week or every other week. We did it every other week, and so we wound up with about 6 months. Yes.
The current cohort is doing it every week, so it'll be 3 months.
Oh, the other question is, can you begin at any time? Or when do you do?
Got to start at the session. We can talk about that.
Okay.
Okay. In my community, there's a ministerial association
which kind of sounds like how you guys kind of started out, but it is very, very racially separated. It is a black-only ministerial association. How do you get past that? Because obviously you all have. And so it's been on my heart for this community that I love in Hawkinsville to come together and ministers not care about whether they're with the black church or a white church.
I don't know that we've gotten past it, to be honest with you. I think that, I think Katherine is our interesting and odd person in the mix. But here's something else in regard to that. I know that when we focus on doing what we were doing together, it wasn't male, female, black or white, red or yellow. It was just, here's another person to assist us in the process in the collaboration. You know, I came to Eatonton and I realized I live, and I still live as a white pastor in a very segregated world. By that I mean that my world has very few African American people in it. So when somebody like Katherine comes along, I latch onto them because she meets one of my needs. That's selfish, but Katherine is brave enough to let me do that anyway. And then we can do more than just meet my selfish needs. We become friends, and Katherine's invited to my church during Holy Week to preach. So, you know, if you can find something to do together. I know the other thing about yours, and I've heard other ministers say this, if there is an African American ministerial group, find out who's the chair, find out who's the leader, make contact with them, and ask for an invitation. Ask if you can attend. My experience has been, and others in the article that I was reading that was talking about this, is 9 times out of 10, they'll say, we'd be glad to have you. Now, the African American community often does not meet on days that are convenient to us white folks. And part of that is because they meet primarily on Sundays, because they're in community on Sundays. And by the time they're meeting, we're taking a nap. And we have to give up that, and we have to join with them. A part of what I tried to do with us when I first went to Eatonton, I was trying to break into some connections with African American people. I got accused by who was chief of police at the time, we became close friends, of organizing for a march, because that was the day of Black Lives Matter. But I had gotten a city magistrate judge to invite some of her black friends, and they were coming to my fellowship hall, and I was just meeting them. And I've continued a relationship with one or two of those. One of those ladies unfortunately died with COVID. So you have to reach out. I think the white community cannot wait for the black community to come to us. That's our tragic racist mistake. We have to go there. I go to the MLK March every year. I wound up, because I wanted to be in the black community, we have one barber downtown. Grady is African American. I stood at my head door, you cut my hair? He looked at me, yeah. Well, when can I come? That was during COVID, and made an appointment. We've been going ever since. And we both surprised one another. We didn't know what we were going to be like to one another, but we both took the risk. And then his wife is an African American pastor there in the community too. So that created something. This collaborative with Cecil Kilgore and the whole connection to the Kilgore brothers. All of that has been a part of the collaboration. And with Charlene, that's happened out of us doing some things together. But that's kind of the way we bridged it.
Thank you.
Could I address that as well? As a president of the Coffee County Ministerial Association in Douglas, Georgia, it's a mixed group. It's a mixed group, but the group is predominantly white.
Okay.
It's predominantly white. But we do have a few African Americans that attend. But when I first started with the group, it was 3 old white men and me. Okay? So again, to what the brother said, make a call. And if you're not going to be uncomfortable going, they won't be uncomfortable having you. And you may just be the spark that opens the door, and it just becomes an American group and not an African American group. Okay? I believe you can do it.
I'm a faith community nurse, but my daughter is a pastor.
Yeah.
And so I will pass that on.
There's a song we sing, send her, she'll go.
I want to also talk to this young lady. Even though myself and Pam are friends, Pam hired me at Putnam General Hospital years ago. And I started out as a CNA, and I looked around and said, I could do more than this. And with the encouragement of Pam, I went on to school, LPN, went from LPN to RN. We were still friends. And I think that's the collaboration. If you go into something looking at color, you won't do anything. But if you go in there with an open mind to say, I'm going to collaborate with these people, they got what I need, I may have something that they need. I'm here today, I rode on a van with nothing but white people. But we had the best, well, and this way. Forget about this way. But anyway, there are many times that I go to a meeting and I don't see people that look like me. That does not keep me from doing what I need to do because God has a purpose on my life. Whoever walks into the hospital setting, I don't care what color they are, you do what you do to help whoever you need to help. So close your eyes to color, open your eyes to opportunity because it is there.
You got time for one more.
I want to say something to you. You may want to talk to some nurses in the hospital. I mean, we work together. When we're taking care of a patient, it does not matter if this nurse is black or this nurse is white. So I'm sure there's some camaraderie in there. I mean, Charlotte danced at my daughter's wedding, so I mean, you can use that as a resource.
And to the young lady over there, when I was growing up, I didn't know anything about, I guess you'd say, mistreatment of black people because I grew up in the country. Okay, but until I went to the city. But I want to say this, I am like Charlene in a lot of ways. My father always told us that you be the best you can be wherever you are. And when I went to the University of South Carolina, you could count the people of color on one hand. I had a tough time, but I graduated with my degree in biology and a minor in chemistry. And I've been a lot of firsts in my life. And sometimes one of me only in class or someplace, but it has never deterred me from reaching my goals. And I'm the first woman to be ordained in my church because it's strictly, I guess you could say, go by the rules. They don't have women, but they have this one. And another thing is that I joined the Pink Ladies, and I was their first Afro-American president. And because I belong to everybody, I just love people. And as an old teacher for 30 years retired, my goal was to teach my children how to love each other, get along with each other. And the main goal was to learn and improve themselves. So you can get that done. All you have to do is just invite.
It's your turn.
I was just waiting. Question for Charlene.
Yes.
You mentioned in November your community will be doing a health fair. So the health fair that you are doing, is it, are you all providing services, or how do you get the vendors that are coming in? Is this all inclusive in your neighborhood? You have
This is
Come
out of
from
the
out.
winter of the health fair, she can tell you all.
We have people from all over. We have Georgia College and state universities, like 20 miles from us, so they have a school of nursing. And they do clinicals at the hospital, and they have to have so many community hours. And last year, I think they sent about 12 nursing students, and they had a ball. They did we checked hemoglobin A1C, we checked blood pressure, we checked a variety of things. And this year when I called the instructor, it was African American, and Talisha, and I can give you her number if you're interested. But she told me, she's like, "Ma'am, I got 40 people that want to come, 40 students." I'm like, well, I don't know if we can use all of it. But we have those individuals. Mercer Medicine, Charlene is involved. She's my helper. I've got another nurse and Putnam County that's a helper as well. But the School of Medicine, they do a teddy bear clinic for the pediatric participants. So we just got a list and we go down, and hopefully we'll get more each year.
The Morehouse School of Medicine.
Morehouse School of Medicine. We had a blood drive. The Red Cross was there and actually had a blood drive last year, but this year can't make it. But we'll figure out something else. We've got food trucks and all kinds of things.
And we have Cecil Kilgore, who is a great asset for a lot of those things too, because he's done that in the past. I feel like I blow a lot of smoke and they do all the work. They really do. And having the medical people and the Putnam General Hospital and participation of Alan Horton, the administrator there, that's helped a whole lot.
And is it advertised, like is it on the hospital's website? I'm just curious. I've never
Yes.
heard- Is this your first time doing that? Of course not. Okay, okay.
Find contact with Cecil Kilgore and Pam Douglas from Paul Byrd.
Send me an email. Guys, we could do more, but I think we're all a little tired, and we're at the end of our time. Can you offer these folks a round of applause? Thank you.